We are going to get started. I do have a quorum, so in a moment we will call the roll. I do want to note, I just heard that the Senate will be going back into session at 4 o'clock, so we do have a limited time to get all of our business ready. We also have to get through all of our business before 4 o'clock. We also have some scheduling matters that I want to just briefly mention. We've got at least 3 assembly members here that need to be elsewhere. So if there's no objection, I'm going to take item number 1, Mr. Davis, then item number 2, Mr. Gatto, and then item number 8 for Mr. Wagner so that they can go to the other places that they have obligations for. If there's an objection, let me know. Come on up and talk to us. I'm seeing a possible problem there. But we want to try to accommodate everybody the best that we can. So we'll call the roll, and then we'll start with Mr. Davis. You can start coming on up. And I would urge you, if you have no opposition, state that and just be as brief as you can, and we'll try to get you out of here as quickly as possible. So we'll call the roll.
Evans.
Here.
Evans here. Harmon. Harmon here. Blakesley. Corbett. Leno. Leno here.
All right, go ahead, Mr. Davis.
Thank you, Madam Chairwoman.
126.
Thank you, Madam Chairwoman and members of the Judiciary Committee. This bill seeks to create an environment of inclusion for our judicial selection process. I will be working with the governor to further develop the bill. This bill will do basically 3 things. It will ask for us to work closely with the Judicial Selection Committee for the purpose of making sure that we include people from various communities in the recommendation process. 2, it will seek to make sure that each member of the State Bar responsible for evaluation of the judicial candidates to complete 2 hours of mandatory training in the areas of fairness and bias in the judicial appointments process. And lastly, the bill will require the State Bar and Judicial Council in their annual reports to use ethnic and racial categories designated and used by the Judicial Council. These categories largely mirror those used in the 2010 census. With me today is Linton Borton from the NAACP and Liberty Sanchez from the California Public Defenders Association. I respectfully ask for your vote.
Thank you, Mr. Davis. And I'll just mention that the bill has no opposition, and we have seen this item before. So if you could be very brief in your statements of support, I'd appreciate it. Okay. Go right ahead.
I'm Linton Borden from the California Conference NAACP. We're in support of the bill. Just want to highlight the bias training. I think it's important. It's very minimal, but important.
Liberty Sanchez on behalf of the California Public Defenders Association. This is a modest but very important measure that will better ensure the fair administration of justice in this state. We are in support. Thank you.
Valerie Small-Navarro with the ACLU in strong support.
Thank you. And I do agree the training is very important. Any other witnesses in support of the bill? Any witnesses in opposition? Any questions or statements from the members? Mr. Leno?
Ms. Sanchez said it for me in that it is modest, but it's very important. And
Sir.
I think we all recognize in this democratic society that we have, we need justice. Justice is based upon a judiciary in which the populace believes there is the opportunity to seek justice, and that means having a transparent and fair selection process for our bench, and that's what you're trying to get at. So I'm happy to support the bill and to move it.
Thank you very much, Senator.
Okay, we have a motion. We'll call the roll.
The motion is due pass to Senate Appropriations Committee. Evans.
Aye.
Evans, aye. Harmon. Harmon, no. Blakesley. Corbett. Leno.
Aye.
Leno, aye.
The vote is 2-1. We'll leave the roll open for members who are absent. And thank you very much for being so speedy. Appreciate it. Item number 2, AB 173, Mr. Gatto. Hi.
Good afternoon, Madam Chair. AB 173 is very simple. It extends until December 31, 2016, the statute of limitations for victims of the Armenian genocide for their heirs to file lawsuits in California courts against insurance companies. This is just some quick history. So heirs for the Armenian genocide have only had the ability to file suit in California courts starting in about 2000. For much of the time that they've been able to file these suits, their ability to file suits has been under attack in the federal court system. The federal courts recently ruled that it was okay, but during most of the time that they've been able to file suit, their ability to file suit has been called into question. So this would extend it through the 100th anniversary of the genocide. It's a very, very important issue to this community, and I respectfully ask for your aye vote.
Thank you very much. Are there witnesses in support of the bill?
Just me.
Just you. Witnesses in opposition? All right, no witnesses in support or in opposition. We have seen other items like this as well as the original legislation. It seems like the fair thing to do. Any comments or questions from the members? Mr. Harmon has moved the bill. Call the roll.
The motion is due pass to the Senate floor. Evans?
Aye.
Evans, aye. Harmon? Aye. Harmon, aye. Blakesley? Corbett? Leno? Leno, aye.
All right, the vote is 3-0. The bill could get out, but we will keep the roll open for the absent members.
Thank you very much.
Thank you again for being so quick. Item number 8, then, without objection, we will go to, and Assemblymember Wagner.
Thank you, Madam Chair, and members of the committee, and thank you to Mr. Swanson, who did allow me to jump ahead of him in order. This is
Ms. Atkins, who is ahead of you as well.
She's not here, and I think Mr. Swanson was here. But thanks to all of my colleagues for allowing me to go ahead of them. This is Assembly Bill 997, which deals with professional fiduciaries. Currently, those who manage fiduciary assets are under reporting and regulatory requirements. There are a number of exemptions, however. The statutory exemptions are for attorneys, accountants, enrolled agents before the IRS, also for trust companies, FDIC-insured institutions, broker-dealers, those who are otherwise regulated. And the concerns that motivated the Professional Fiduciaries Act in the first place provided these exemptions because these entities are otherwise regulated and are not the abusive actors that required the Professional Fiduciaries Act in the first place. However, the exemptions missed a number of charitable organizations, in particular a number of university and university foundations, hospitals, their foundations, entities that are not the abusive entities that required the regulation in the first place. What this does is add a number of those organizations to the exemptions that already exist. There is only one letter of opposition that I'm aware of from the Professional Fiduciaries Association. Otherwise, this has enjoyed broad and bipartisan support, and I urge an aye vote. Thank you.
Great. Thank you very much. Witnesses in support.
Yes, Robert Oakes with the Association of Independent California Colleges.
Speak right into the microphone.
Robert Oakes with the Association of Independent California Colleges and Universities in support.
Bob Naylor, Stanford University, in support for the eloquent reasons in the committee analysis, the excellent committee analysis.
Thank you very much. We appreciate that. Other witnesses in support?
Michelle Peralt with California State University, also in support of the bill. Thank you.
Great. Any witnesses in opposition? All right, we do have a letter of opposition, but apparently they don't care to testify. Any questions from the members? Mr. Harmon?
No questions, but I will tell you I think this is a very good bill. I'm pleased to be a co-author of this bill along with Assembly Members Feuer and Jeffries. I'd urge an aye vote, and I move approval of the bill.
Thank you, sir.
All right. We have a motion. We'll call the roll.
The motion is due pass to Senate Appropriations. Evans?
Aye.
Evans, aye. Harmon? Harmon, aye. Blakesley? Corbett? Leno? Leno, aye.
All right. 3-0 at this point. We will keep the roll open for the absent members.
Thank you, Madam Chair. Thank you.
You're very welcome. All right, Ms. Atkins, item number 3, AB 499.
Thank you, Madam Chair.
And I appreciate your indulgence.
No, it's okay. I haven't mastered, like some of you, the art of being in 3 places at one time. But thank you very much, Madam Chair. I'm here to present on AB 499, and that improves access to medical care for youth. The bill would allow minors aged 12 and over to consent to receive preventative medical care against sexually transmitted diseases. Under current law, youth may be diagnosed and may be treated confidentially if they've been exposed to an STD. In fact, every state lets teens do this. Controlling the spread of STDs among our children is an important matter of public health. We now have proven vaccines for human papillomavirus, or HPV, and HIV prophylactic medications. With these preventative options, it's extremely important to protect teens before they become sexually active. And as a state, I think, why wouldn't we provide youth with direct access to treatment services after they've been infected, but then leave them without medical options to prevent catching diseases in the first place? It doesn't make sense. Requiring parental consent leaves out many teens because it assumes wrongly that parental involvement is always a realistic and safe option. If parents can't be involved, this bill gives those teens their only option to get protection against diseases. AB 499 is sponsored by medical professionals, youth advocacy organizations, community clinics, and many others. With me in support are Dr. Susan Phillip of the STD Controllers Association, Bruce Palmer of the Health Officers Association, Rebecca Gudeman of the National Center for Youth Law, and Shannon Smith Crowley of the American Congress of OBGYNs. So I would respectfully ask for your support, and I'm ready to answer any comments or questions.
Thank you very much. Let's go to witnesses in support.
Yes, Dr. Susan Phillip, California STD Controllers Association. It's an honor to testify today in support of AB 499 on behalf of the California STD Controllers Association, or the CSTDCA, which is the sponsor of the bill. CSTDCA is comprised of local officials responsible for STD prevention and control in each of the state's 61 health jurisdictions. I'm an infectious disease physician by training and the president of STDCA. I'm also the STD controller for the city and county of San Francisco. I am not speaking today on behalf of the city and county. CSTDA is sponsoring AB 499 because it would improve both public health and the health of minors aged 12 and older in California by explicitly giving them the right to consent by themselves to preventive services for STDs. Currently, minors aged 12 and older have the right to consent to medical care related to STDs and reproductive health services, but not the preventive services related to STDs that they need. AB 499, therefore, addresses a gap in the current law. In the past, effective interventions to prevent STDs did not exist, but today a number of safe and effective interventions can, in fact, prevent STDs, including HIV, and save lives. That's incredibly important for youth today, since national studies suggest, on average, that young people have sex for the first time about age 17. Here are just two examples of how STD prevention can potentially reduce disease and save lives. First, vaccination against human papillomavirus, or HPV, which can cause cervical cancer. In 2008, there were nearly 1,500 cases of cervical cancer in California, and 424 Californian women died of cervical cancer. HPV can also cause anal cancer, genital warts, and other diseases. In the past 5 years, 2 vaccines against HPV have been approved by the FDA. The CDC has recommended HPV vaccination for girls and women aged 12 to 26. And we know that HPV vaccines are most effective if given before a person becomes sexually active. Second, consider HIV infection. Since 2006, over 40,000 Californians have been diagnosed with HIV infection, including over 1,000 13 to 19-year-olds. Since the beginning of the epidemic, we've lost nearly 160,000 of our fellow Californians to AIDS. Public health workers and healthcare professionals continue to educate Californians, but we have now post-exposure prophylaxis for HIV, or PEP. If given early and taken properly, PEP is estimated to be 80% effective in preventing HIV infection. AB 499 would also cover other effective preventive services for STDs that currently exist, including hepatitis A and B vaccinations. And some promising preventive services are in development, including medications to prevent vaginal gel and oral medications that have also been shown to be effective in preventing HIV. It's time to update California's laws related to minor consent and STDs to include access to safe and effective interventions related to prevention. To safeguard the health of California's youth and prevent the spread of potentially life-threatening STDs, including HIV, I urge the committee to pass AB 499.
Thank you. Next witness.
I'm Rebecca Gudeman. I'm a senior attorney at the National Center for Youth Law in Oakland, and I run the center's Adolescent Health Law Project. One of our core concerns at Nickel is making sure that youth who are abused, neglected, homeless, or otherwise at risk have access to critical health services. In short, we're concerned about making health care available to the youth who often have inconsistent or dysfunctional parenting, or none at all. In my capacity at Nickel, I'm frequently consulted by healthcare providers about California's medical consent laws and how to make sure that youth get the services they need. Over the years, I've received many calls from those who want to provide time-sensitive, preventive STD care to at-risk youth, but can't because the youth's parents can't be found at all or on a timely basis, or can't be consulted. These providers ask me if there's any law that would allow them to help their patients, and right now there really isn't. AB 499 would fix that. It's important to note that AB 499 would not stop teens from consulting and involving their parents in their care, and research shows us that most teens do talk to their parents about sensitive health issues, even about health care that state law allows them to keep confidential. But for some teens, family communication is simply not possible and actually can be dangerous. This bill will ensure services are available to these teens as well as their friends. Just over a dozen states already allow most or all minors to consent to the prevention of STDs, and passing AB 499 would simply allow California to catch up with these other states and help our most vulnerable youth. Thanks.
Hi, Shannon Smith Crowley, American Congress of Obstetricians and Gynecologists. I echo the comments of the witnesses. We're a co-sponsor of the bill, and I'm available for questions.
Great. Thank you very much. Any other witnesses in support of the bill? I see a long line coming forward, so if we could vacate the seats, I'd appreciate it. And we've had extensive testimony, so please keep your comments very brief. Go ahead.
Madam Chair, Bruce Palmer, representing the Health Officers Association of California, physician health officers in California's 61 local jurisdictions. Proud to be a co-sponsor. We think this is an excellent bill and will do a lot to reduce disease rates in our localities. Thank you.
Kathy Mossberg, California Family Health Council, in support.
Charlotte Newhart, American Association of University Women, strong support.
Thank you. Elena Perez, California National Organization for Women, in strong support.
Beth McGovern with the California Commission on the Status of Women, in strong support.
Allison Ramey with the California Primary Care Association, representing more than 800 nonprofit community clinics and health centers, in support.
Stephanie Zay with Planned Parenthood Affiliates of California, also in strong support.
Mario Guerrero with Equality California, in strong support. Thank you.
Valerie Small-Navarro with the ACLU, also in strong support. Thank you.
Ryan Spencer, the California Medical Association, in support.
Wonderful. Any other witnesses in support of the bill? Any witnesses in opposition? You can take there's 2 seats up here. Go right ahead. So,
you're fine.
Go right ahead.
Oh, thank you. Thank you for the opportunity. I'm Bill May. I'm chairman of Catholics for the Common Good. There's some interesting things that I think the committee ought to be probing on this bill. Let's face it, the reason for this bill was in 2007, there was a bill to require mandatory vaccination. That bill was dropped because the people of California don't want it. There was a public outcry. This is an end run on that. Now, let's consider giving the ability of 12-year-olds to consent. First of all, there's the parents' rights issue, which is fairly obvious. To care for and the health of their children. But in addition to that, a child is not equipped to make the evaluations on the risks associated with this. Do you know that it's been reported, or the Center for Disease Control has reported that there were at least 51 deaths of girls and 2 deaths of boys associated with just one of these treatment, Gardasil. Do you realize that? Now, there's nothing in the bill that requires disclosure to this child from an adult that they risk death, although small. They risk all kinds of other side effects and diseases. Is there any studies about how children process that at that age? They don't have the ability to reason as an adult. They don't even understand the math at that level. And you're opening the door for all kinds of coercion and things of that sort. Children are very susceptible to adult authority. Now, when there's a vaccine given or a medical treatment, there's money to be made on that. That's pretty obvious. The drug companies, also the people delivering the service. There's an incentive. But there's no disclosure. There's no protection in this bill from someone coercing a child into this. The other thing is, with the side effects of these drugs, they need to be dealt with immediately. If a parent doesn't know the child has received this, how are they going to recognize a side effect and get the medical attention to that child that they need? You know, there's been no publicity on this bill. We just learned about it. There's all kinds of other medical organizations across the country that are just learning about it for the first time. People are outraged at the fact that this has not been well thought through. And these are very serious questions that I hope that you will ask of the author and ask of yourselves. I don't think this bill is right for now. I think there's building a very strong opposition to this.
Thank you. Next witness.
Jim Ricketts, co-founder of Tea Party United, representing the Lincoln, Citrus Heights, Carmichael, and Fair Oaks Tea Parties. A couple of years ago, I sat through the school board meeting of the San Juan Unified School District when a similar item came up. I sat there as dozens and dozens and dozens of outraged parents came to testify against the interference of their parental right, with their parental rights, especially where medical procedures were concerned. I can't imagine the level of arrogance that it takes to insert yourself between a parent and his child. I won't repeat what my colleague has said. He has the facts. He presented them very well. But I have heard opposition from parents over and over again. They're not able to be here. Most of them have to work, or most of them have to stay home and take care of their children. So they can't be here to defend themselves. So I'm here defending them for them. So I please ask this committee to very carefully consider whether you have any right whatsoever to insert yourself between a parent and his child.
Thank you.
Thank you.
Next witness.
Hi, my name is Carol Hogan. I'm from the California Catholic Conference, and I'd like to echo a lot of what Bill May said. This does concern parents' rights. Most parents, almost all parents, have their children's welfare foremost in their minds, and we need to legislate with that in mind, not for the few errant parents that don't. There's ways to help those children without damaging the relationship between the parents and the other children. So we would oppose this bill, and we would agree that there needs to be more study, especially since there is a definite chance of harm, and children do not have the judgment to make that decision. Thanks.
Thank you very much. Questions from members? Mr. Leno?
Just a comment. Thank you, Madam Chair. Assemblywoman Atkins, I appreciate you bringing the bill forward. I think we all recognize the sensitivity of the issue. This is not done cavalierly. And I would suggest that we also all agree that we want parents involved in the decision-making, not only with regard to prevention, but also for diagnosis and for treatment of all health issues that children deal with, and specifically with sexually transmitted diseases. And I would imagine in the vast majority of situations, parents are involved. The real world in which we live is in those families where communication does not exist, where trust does not exist. These are the very children who need the benefit of this bill. It's quite real that some children can risk physical, if not emotional, or verbal abuse by even approaching some of these subjects. And where does that leave a child when there's just no trust, if not love or communication there? So I'm sensitive to the parental rights issue. It's real. But again, as you stated in your opening comments, the state already allows for a minor's consent for diagnosis and treatment. Correct. The problem begins at prevention. Why would we leave out that piece? So I'm happy to move the bill.
Thank you, Senator. Yeah, I agree with your comments. I'm the mother of 3 children, and they're all grown now, thank goodness. But it's a challenge, and it's a challenge for the legislature and for the author of the bill, I'm sure, to be able to craft legislation that both recognizes the fact that a lot of kids today do not have parents that either are capable or do take good, responsible care of them. And also to make sure that we don't overdo it, and overstep into the realm that really should be an issue for the family. But the reality is that the families of many young people today are simply either non-existent or not functional. And to me, the risk of not allowing these kids to obtain prevention or obtain preventive measures is greater than the risk of allowing that. So I certainly err on the side of protecting these 12-year-olds and older who are already sexually active, whether we like it or not. I think it's we're trying to be realistic here and deal with the situation as it is, not as we might like it to be. So I'm very supportive of the bill, and we have a motion. Mrs. Atkins, would you like to close?
Thank you, Madam Chair and members. I agree with your comments, so I won't repeat them. I would say that this is closing a gap in state law. Public health is the reason we need to focus on this issue. While adolescent rates are lower than young adult rates, the cases of chlamydia, gonorrhea, syphilis, HIV, and AIDS are of great concern to us for many reasons, because these diseases are the leading causes of preventable infertility and death in some cases in California, affecting all women, but particularly women who are just entering reproductive years. In California, we have informed consent. As a former clinic director of 3 community clinics that provided a range of services to families, both men and women, it is good to have clinical professionals be able to advise on all of the issues that some of the speakers brought up. Aftercare, what to look for, how a preventative works. Those things are included, and I wouldn't want anyone listening today to think that our healthcare system, particularly in our clinics and with our physicians, don't cover those issues. This is a public health issue. I appreciate your letting me make a few comments, and I would ask for your support.
All right, thank you. We have a motion. We'll call the roll.
The motion is due pass to the Senate floor. Evans?
Aye.
Evans, aye. Harmon? Blakesley? Corbett? Leno? Leno, aye.
All right, we have 2 votes and 4 members absent, so we will, or 3 members absent. We'll hold the roll open for members to add on. Okay. And we can go to your next bill, which is item number 6, AB 887.
Thank you very much, Madam Chair. AB 887 adds the term gender identity and gender expression to selected non-discrimination laws where only the term gender currently appears. In doing so, the bill ensures that all Californians, including transgender people, are protected equally under these laws. Under existing law, the definition of gender includes a person's gender identity and gender expression. As such, AB 887 does not confer any new legal status or protections. Instead, specifying gender identity and gender expression in addition to gender makes our non-discrimination laws easier to follow for those who employ, who house, who insure, and educate Californians. It also helps transgender people better understand their protections under the law. AB 887 received bipartisan support in the Assembly, and with me to testify today are Mason Davis, Executive Director of the Transgender Law Center, and Mario Guerrera, who is the Government Affairs Director at Equality California, and I would request your support respectfully today.
Thank you. Go ahead. Whoever's first.
Okay. Good afternoon, Chair, members of the committee. My name is Mario Guerrero. I'm here on behalf of Equality California. Equality California is a proud sponsor of AB 887, and we thank Assemblymember Atkins for her leadership and for her authorship of this bill. Equality California has successfully advocated for the passage of over 70 bills aimed at protecting the rights of lesbian, gay, bisexual, and transgender Californians. Our efforts have aided the passage of bills intended to combat discrimination based exactly on gender identity and gender expression, such as AB 196, authored by then Assemblymember Mark Leno, now Senator Leno, Gender Non-Discrimination Bill of 2003, and many others. A lot of work has been done in California to create a state free of discrimination, but we still have more work to do. AB 887, the Gender Non-Discrimination Act, is a bill that further strengthens civil rights protections. AB 887 takes existing protections based on gender identity and gender expression and enumerates these protected categories in our non-discrimination laws. By enumerating existing protections, people will more clearly understand California's non-discrimination laws. This would also increase the likelihood that employers, housing authorities would work to prevent discrimination and respond more effectively and expeditiously at the first indication of discrimination. For these reasons and many others, I respectfully ask for your aye vote. Thank you.
Thank you. Go ahead.
Good afternoon, Chair, members of the committee. My name is Mason Davis. I'm the Executive Director of the Transgender Law Center, and I want to first thank Assemblymember Atkins for carrying this important piece of legislation. AB 887 is a simple, common-sense bill that would clarify California's non-discrimination laws and promote the equal treatment of all people throughout our fine state. California is at its best when we work together to realize the ideal that everyone should be treated fairly and equally. To this end, our legislature acted with the best of intentions when it extended a large number of anti-discrimination protections to transgender people over the last 10 years. Unfortunately, people who don't fit narrow gender stereotypes continue to face discrimination that undermines our common human dignity. Despite current laws, we still have incredibly high rates of discrimination against transgender people, with up to 70% of transgender Californians reporting employment discrimination based on a 2008 survey. Few transgender people file complaints, though, even when experiencing severe harassment in the workplace, because they don't actually know they have their legal rights. Since the early 2000s, our protections have been within the definition of gender. Unfortunately, few employers, workers, healthcare consumers, and others actually look up definitions in California's legal codes. As a result, we found persistent challenges with discrimination that could be fixed by simply adding gender identity and expression as their own explicitly protected categories. As a result, employers and others would understand non-discrimination laws more clearly, which in turn would increase the likelihood that employers would work to prevent discrimination and to respond more effectively to the first indications of discrimination. All hardworking people in California, including transgender and gender nonconforming people, should have the chance to earn a living and provide for our families. The Gender Non-Discrimination Act would strengthen the ability for us to do that, and we urge an aye vote on this bill.
Thank you very much. Other witnesses in support?
Sabrina Means on behalf of the California Faculty Association, which represents the faculty at the California State University Systems, in support.
I'm Janae Lawson. I'm a youth with Gay Straight Alliance Network, and I respectfully and strongly urge your support of this bill. Thank you.
My name is Mary Helen Doherty, and I'm here on behalf of California Faith for Equality. We're a statewide organization of clergy and congregations that support full equality for the LGBTQ community, and we ask for your strong support. Thank you.
Thank you.
Mariko Yoshihara with the California Employment Lawyers Association in strong support.
Bonnie Osborne on behalf of the Sacramento Rainbow Chamber of Commerce, representing approximately 150 area LGBT-owned and supportive businesses in strong support.
Thank you.
Hi, Sarah Freed, Executive Director of Sacramento Gay and Lesbian Center, in strong support.
Carolyn Kim with Public Advocates in strong support.
Elena Perez, California National Organization for Women in strong support.
Beth McGovern on behalf of the California Commission on the Status of Women in support.
Caitlin Vega for the California Labor Federation, also here in support.
Valerie Small Navarro with the ACLU, also in strong support.
Any other witnesses in support of the bill? Any witnesses in opposition? All right, seeing none. Any questions or comments from the committee members? Mr. Leno?
Thank you, Madam Chair. This bill, I see it as really cleanup language and also updating language to that which is already statute in California. And it will have great benefit not only to the transgender and gender nonconforming communities, but as mentioned, also to employers and landlords. And so it's a cleanup bill that we need. I'm happy to move the bill.
Thank you. All right. Ms. Atkins, would you like to close?
I think the senator gave my closing. I would respectfully ask for an aye vote.
Perfect. All right, we have a motion. We'll call the roll.
The motion is due. Pass to Senate rules. Evans?
Aye.
Evans, aye. Harmon? Blakesley? Corbett? Leno? Leno, aye.
All right, the bill has 2 votes, and we'll keep the roll open for the absent members.
Thank you.
Thank you very much. Next is Mr. Swanson. Item number 4, AB 559.
Madam Chair, thank you very much, and members of the committee. AB 599 is a bill that we believe will decide finally that the level of your wages should not be determined of whether or not you have access to justice. This bill will help ensure that Californians have fair and equitable access to civil justice system for discrimination claims brought under the Fair Employment and Housing Act. A recent UCLA RAND study highlighted significant disparities with respect to legal representation in these cases and in the claim amounts. Unfortunately, the situation has been made even worse as a result of a recent California Supreme Court decision, Chavez versus the City of Los Angeles. In that case, the court held that a trial court in the Fair Employment Housing case could deny successful plaintiffs' attorney fees when the plaintiff chooses to proceed in an unlimited civil action, but recovers less than $25,000. This case results in a two-tier system of justice. I'm going to ask my witness to self-introduce, Madam Chair.
Thank you. I'm Scott Bernstein here on behalf of the California Employment Lawyers Association, an association of approximately 1,000 attorneys who represent workers throughout this state. As a practical matter, AB 559 restores the illegality of discriminating against low-wage individuals. The Chavez decision imposed an impossible choice on attorneys who represent workers who have been discriminated against in the workplace. It was not I think the intent of the court to do this, but it was the practical effect of it to impose this impossible choice on the primary means of enforcement of these important laws. And that choice is this. If a low-wage worker comes in, a janitor who makes, say, $10 an hour comes into your office, the monetary consequences of the discrimination are not very large. So you've got two choices. You can file the case as a limited jurisdiction case and be taking a serious risk of committing malpractice and violating the rules of professional conduct, the ethics rules, in at least two ways. Or you can file the case as an unlimited jurisdiction case and take a very serious risk of not getting paid. So you can only afford to take so many pro bono cases on in your practice. But there's a third choice. Faced with that choice, you decline the case. You really have no meaningful choice, and the worker has no meaningful access to justice. Checkmate. Either we as a society are serious about eliminating discrimination in the workplace, or we're not. If we are, we have to pass AB 559. We ask for your aye vote. Thank you.
Thank you very much. Other witnesses in support?
Madam Chair and members, Caitlin Vega for the California Labor Federation. We are here in support. We think that this really is a matter of access to justice. If low-wage workers cannot afford attorneys, it creates additional incentives or it eliminates the disincentive for employers to violate workers' rights in the underground economy and in low-wage industries. And so we think that this is particularly important to helping, as Mr. Swanson referred to, the study. The study demonstrated that it was low-wage workers, women workers, people of color who are much less likely to find attorneys to handle these kinds of cases, which then leads to increased noncompliance with our civil rights statutes. So that's why we're in strong support. Thank you.
Thank you.
Members Paloma Perez on behalf of Consumer Attorneys of California, also in support.
Other witnesses, come on up.
Beth McGovern with the California Commission on the Status of Women in strong support.
Elena Perez with the California National Organization for Women in support.
Madam Chair, members of the committee, Lee Sandall with the International Longshore and Warehouse Union, and we are in support.
Okay, great. Any witnesses in opposition to the bill?
Thank you, Madam Chair. Members, Mira Girton here on behalf of the California Chamber of Commerce in opposition to this bill. We believe that this bill is unnecessary. However, we are prepared to deal with some alternatives, some things that we've talked about in the past. Primarily, our concern is that this bill deals with two conflicting statutes, not necessarily conflicting, but that can be harmonized, and that the Supreme Court of California did say could be harmonized in the Chavez decision, which this bill would overturn. One statute serves the purpose of making sure that low-income employees receive access to justice and have access to employers. We know that that is a very access to an attorney. We believe that's a very important goal. The other statute deals with making sure that plaintiffs' attorneys are incentivized to bring their case in the appropriate forum and to expedite those processes where it's appropriate. And if it's not appropriate, then they can bring them as unlimited civil cases. So we believe that this bill goes too far in seeking to completely carve out all FEHA cases from that second statute. And we believe courts should have discretion under both, and that discretion was appropriately used in this situation. One of the things that gets pointed out in the Supreme Court's decision is that the attorney basically worked for 9 years on this case, and I can imagine that a lot of plaintiffs' attorneys would be worried they would put in that amount of work and then not have their fees granted. However, in this case, the fee request was already inflated at about $430,000 request, and then they actually put in a lodestar multiplier and asked for $870,000 in attorney's fees when they recovered about $11,000 and provided no evidence whatsoever of economic loss and an equally sparse record for non-economic loss. So we believe that the discretion was used appropriately and that the Supreme Court has included a lot of language in the decision which I think will reassure plaintiffs' attorneys that so long as the plaintiff's attorney had the only reason that these fees would be denied is if the plaintiff's attorney had no reasonable basis to anticipate a fee award in excess of the $25,000 limit, and also that the action could have been fairly litigated. So even if you think you're going to recover less, but you don't think that you can litigate your case appropriately as an unlimited civil case, the Supreme Court has basically said it's inappropriate to deny the award. So for these reasons, we oppose this bill. Thank you.
Catherine Pettibone with the Civil Justice Association of California. I'd like to echo my colleagues' remarks. When reading the case, it didn't overturn the idea that the FEHA policies have to be given due consideration and that they serve a very important public policy. In this case, the court decided not to award any, but the court also noted that you can reduce awards. So the fact that they chose not to even award any speaks to the extreme circumstances in the case. Additionally, attorneys and also the court can reclassify the case if later it appears that it has been inappropriately classified. So for these reasons, we feel that this bill strikes too broad a swath.
Cynthia Leon with the California Manufacturers and Technology Association. I echo my colleagues' comments and believe that the court has the ability to exercise their discretion at this time.
All right, thank you very much. Any questions or comments from committee members? Mr. Leno?
Mr. Swanson, could you respond to some of the oppositional comments?
Well, first of all, this bill passed this committee last year, and one reason it did was because the court still has discretion over determining the amount of attorney fees. The second reason I think it passed this committee is because there's a higher principle of equal justice that applies here, where you have a wage case where the recovery in wage is only $1,000 versus one where the recovery might be $100,000. That should not determine representation. And so we're simply trying to level the playing fields and make sure that the principles that are involved in discrimination have all the tools necessary to be argued properly before the court. The court then can make the determination on what a fair and reasonable compensation for attorney fees are. But we think that that's clear in this bill, and it really levels the playing field. But the low-wage worker claim may just be $1,000, but there may be also 1,000 employees that are affected by that, and that makes the most important point under fairness under the law.
Thank you. I think that's a fair response, and my concern is that it does eliminate any disincentive for the employee being treated properly and according to law. So I will move the bill.
Thank you.
All right. It's the access to justice issue that you so eloquently stated, the choice between two, or one good choice, one bad choice, and then the third choice being not to take the case at all. And I think that realistically that is what is likely happening under the current law. So I support the bill as well. So we have a motion. We'll call the roll.
The motion is due pass to the Senate floor. Evans?
Aye.
Evans, aye. Harmon? Blakesley? Blakesley, no. Corbett? Leno? Leno, aye.
All right, the vote is 2-1. We have two absent members. We'll hold the roll open.
Thank you very much.
Thank you very much.
Thank you, Mr.
All right, Mr. Perez. Item number 5, AB 588.
Just got some wires here. Just want to make sure no one falls.
Go right ahead.
Thank you, Madam Chair and Senators. Good afternoon, everyone. Approximately 1 out of every 4 women will experience a form of domestic violence in their lifetime. Domestic violence often becomes so severe that women need to leave their homes. Current state law allows victims of domestic violence to petition for early lease termination, from their rental unit provided that they present a copy of a police report or restraining order to the landlord within 60 days. However, on the ground, organizations who work with domestic violence victims report that 60 days is an insufficient amount of time for victims to determine whether or not they need to move. Victims of domestic violence need a bigger window of time during which they are ensured the option to vacate if it becomes necessary for their safety. This bill, AB 588, would therefore extend the time frame to 180 days. This modification will afford greater protection and flexibility to survivors of domestic abuse by giving them more time to submit a formal request to their landlord to terminate their lease due to being a victim of domestic violence, sexual assault, or stalking. Nothing in this bill exempts a victim from providing 30 days notice and paying the last month's rent. There is no known opposition to this bill. There is support from both sides of the aisle, and I respectfully ask for your aye vote.
Thank you. Witnesses in support.
Madam Chair, members of the committee, Ron Kingston representing the Apartment Association, California Southern Cities. We support the bill. We find it an appropriate vehicle, as Mr. Palmer is even nodding he agrees to. We urge the committee to vote aye.
My name is Camille Hayes. I'm with the California Partnership to End Domestic Violence. We're California's statewide domestic violence coalition representing 200 domestic violence advocates and organizations. I'm here to register our strong support of AB 588, which would give victims of domestic violence greater protection when they're fleeing a dangerous environment in search of safety for themselves and their children. Increasing the life of their documentation from 60 to 180 days would allow more domestic violence survivors to leave abusive situations and seek refuge. Domestic violence victims put themselves and their families at great economic risk when they leave their homes to escape violence. With proposed cuts to welfare, food stamps, and medical subsidies, they'll face additional barriers to finding safety. This bill will help survivors get some respite from these hardships by removing at least one barrier that victims face in escaping their abusers and moving to safer homes. Thank you.
Thank you. Other witnesses? We could maybe clear some of the microphones. Oh, there we go.
Elena Perez with the California National Organization for Women in Support.
Beth McGovern on behalf of the California Commission on the Status of Women in Support.
Great. Any other witnesses in support of the bill? Any witnesses in opposition? And we have received no opposition. This is an excellent bill. I'm really pleased to see that there's so much support of it as well.
Well, thank you, Madam Chair. Quite frankly, I have to state out loud that this bill came from the person that's sitting right next to me, who is my staffer and has come to this, came to me saying this, she's very passionate about this. So Tomasa is actually the person that brought this idea forth.
Madam Chair, I move the bill.
All right, we have a motion. We will call the roll.
The motion is to pass to the Senate floor. Evans?
Aye.
Evans, aye. Harmon? Blakesley? Aye. Blakesley, aye. Corbett? Leno? Aye. Leno, aye.
All right, we have 3 votes. 2 absent members. We'll leave the roll open for other members to add.
Thank you, Madam
Thanks
Chair.
very much. It's a very good bill, and I think it will be very good for women across the state.
Thank you.
I'm advised that we have our next 2 presenters on their way, so we hope that they are out in the hallway somewhere. So we don't want to wait too long. We've got session coming up. No consent calendar. So if the members don't mind, we will hang out for a few minutes and wait for the next author, who is Mr. Wojkowski. are on, Mr. Wojciechowski.
Wow.
Good job. We've only been waiting a few seconds, so you did good.
I apologize.
That's okay. You got here. Your item is item number 7 on our agenda, AB 929.
Madam Chair and members, thank you for indulgence. This legislation is designed to provide appropriate and much-needed relief for California debtors. Current exemptions under bankruptcy leave debtors with too little to effectively restart their lives again. Almost 2/3 of Californians are living in homes with negative equity, and bankruptcy exemptions are currently of little assistance. The exemptions that we seek to increase today adjust the home equity, the tools of one's trade, and the automobiles. As the committee analysis reflects, these changes are modest adjustments to the bankruptcy exemption scheme. With these proposed changes, debtors are left with enough essential resources to pull themselves out of debt. There will always be a debate over what is the appropriate level of the homestead exemption and some of these exemptions for tools of the trade. I believe we've struck the right balance in this public policy question, and I'm here to answer questions.
All right. Do you have witnesses?
No.
No witnesses in support. Okay. I think we'll go ahead then with opposition witnesses. Witnesses in opposition to the bill. Come on up.
Afternoon, Madam Chair, members. Alex Alanis with the California Bankers Association. I apologize for the late opposition. We've been in conversations with the author regarding amendments to the bill to remove our opposition from the bill. The one section we're looking to remove is the increase in the exemptions for the homestead exemptions, which are section 704.730. As you well know, 2 years ago, Assemblyman Anderson had AB 1046, which was signed by the governor, which increased the homestead exemptions from $50,000 to $75,000, $75,000 to $100,000, and $150,000 to $175,000. It also required the Judicial Council to review those exemptions for consumer price index increases every 3 years. And as I understand it, they are going to report back to the legislature on April 1st of 2013. We see no urgency to increase the homestead exemption requirements in the bill. The other parts in the bill I think we're going to be fine with, but it's just this one section here. We think that there's no reason to move forward quickly. There's still a couple more years left to see if there should be a recommendation by the Judicial Council to increase those. But the way they're set up in the bill, you see 3 levels that are being increased over the past 2 years at 3 times the amount that it was in 2009, 3.3 times increase from 2009, and 2.3 times increase from 2009. So it's quite a big jump from 2 years ago. Our recommendation is to remove the homestead exemption part of the bill and just wait for the report back from the Judicial Council.
Okay, appreciate it. And you did send us a letter, I believe, right? No? You have not submitted a letter?
We did not submit a letter. We thought we were at a place in which we had an agreement to have that part removed from the bill. We're hoping that can actually be done. I guess it cannot be done in this committee, but we hope that type of agreement could be resolved should the bill move forward and while the bill's on the floor.
Where's the staff?
All right. Okay, thank you. Any other witnesses in opposition? All right, Mr. Wojciechowski, would you like to respond to what was raised by the opposition testimony?
Yes. I'm always open to review of these levels. I think, and I do acknowledge Senator Anderson's bill that raised them. I guess the question is where's your starting point? I mean, my previous job long ago was working with Don Edwards, who was the congressman who was the floor manager of the Bankruptcy Reform Act of 1978. And part of the goal of bankruptcy is to have that balance between the creditor's rights and the debtor's rights. And if you go back to that early time in 78, when the homestead exemptions were brought out, you had $35,000 for a single person and $50,000 for a married couple. In my town of Fremont, where I'm by, that bought a house. That was the whole enchilada. So we didn't have an unlimited amount, but the dollar amount sort of scaled this. There were some changes in California back in '97 prior to this, but we've seen over in this area rather modest increases where the price of housing has increased. So you have a medium family income home right now of $258,000, and a $75,000 homestead for a single person really doesn't embrace the gist of that public policy that says we shouldn't be liquidating people's homes to pay off credit card debt. So while I think the Judicial Council's review of it is correct, and that's a nice level, at least in my opinion. I'm open to the committee if there's differing views, but the idea is to bring it back up to, at least in my mind, 50% of the house. That policy discussion on whether we should have an unlimited homestead is a legitimate one because Florida and Nevada does that, and that's really up to the decision makers here, the policy folks. So in my review of it, I don't look at it from last year and say there was an increase, which there was. I acknowledge it. I look at it from '78, and I've been doing consumer bankruptcy work for 25 years and saying there's never been a response to that increased value in the general housing over 35 years.
Well, and I think there's some good points raised here. The Judicial Council, I believe, is going to be examining this based on the CPI or changes in the CPI since the last time I looked at it. And nor is it within the purview, I would say, of the Judicial Council to look at the policy that is within the purview of the legislature to
Correct.
examine.
They're just adjusting it from that level of what it was with medium family homes. That's the public policy is your decision.
Exactly, and that's what we're here to discuss today. And I support the public policy that you have set forward, and I was intrigued to find out what you talked about, how Florida and Nevada actually exempt the residents entirely, which we are far short of. And given today's circumstances where a home really is, if people are fortunate enough to actually own their home, that's really their only asset these days, particularly people that are looking at bankruptcy for medical bills or credit card bills or what have you. I think it's critical for the state of California legislature to look at protecting at least some interest of the homeowner. So while I understand the perception that perhaps for the banks, there is no urgency in addressing this issue, I would respectfully differ. I believe that for the homeowners, there's a lot of urgency to address this issue. And so for those reasons, I support what you're bringing forward. If you were to take any substantial amendments, I would reserve the right to bring that back to this committee to review. I'm going to recommend an aye vote today going forward. I'd suggest continuing to talk with the opposition because I think there are some valid concerns, but I would, again, reserve the right to bring that back to the committee.
Thank you.
Any other comments or questions from committee members? Mr. Leno?
Just to say that your historical perspective is helpful, and I think maybe a better metric to look at this is of what percentage of the median home price was that $35,000 at that time, and what percentage of a median home price are the numbers you're suggesting, and I think there's still a significant discrepancy.
Yes, and not in favor of the homeowner.
Correct. Thank you for pointing that out. I move the bill.
All right. I did want to also mention that if you do, as you go along in negotiations with the bill before it gets to the Senate floor, I would encourage you to make use of the Judiciary Committee staff because we can be of assistance in making sure that whatever changes, if any, take place, they would be acceptable to this committee.
Right, and just so the staff will know and members of the committee is that we're really, nobody, the banks and consumer debtors and the Assembly and the Senate don't want to have people sell their homes under threat of bankruptcy and things like that. So what I'm looking at particularly is with these new levels and the old levels, how many people are we talking about? What type of effect will that have? Because some people, I don't want to get into a bankrupt discussion, but the new laws that went into effect in 2005 require more debtors to make repayment on their debt. So it's a changing body of law. Some people aren't eligible to just discharge all their debt. They have to pay it anyway, regardless of what their equity is in their home, if they happen to be lucky enough to have it.
Well, and what we're also really struggling with here is what is the policy of the state of California in protecting the home or the residence of the person that's in bankruptcy? So is it to preserve just some statutory amount, or is it to preserve the residence, or is it somewhere in between? And I think your bill makes it somewhere in between. I mean, the amount that we're talking about under existing law is nowhere even close to the median home price in Sonoma County, for example. So.
Not in San Francisco.
San Francisco, it's not either.
Not in Fremont.
Right. So there may be some areas where it does, it is that low in the state of California, but they're very few and far between. So I think what this committee is trying to say is the policy is to try to exempt as much of the residence value as possible. We're not necessarily stuck to the original amount plus CPI, if that adds any clarity to the negotiations going forward. Okay, we have a motion, and we'll call the roll.
The motion is due pass to Senate Appropriations. Evans?
Aye.
Evans, aye. Harmon? Blakesley? Corbett? Leno? Aye. Leno, aye.
All right, we have 2 votes, and other members are absent, so we'll hold the roll open until they can vote.
Thank you.
Interesting discussion. Thank you very much. All right, I believe, Ms. Huber, you are next. Item number 9, AB 1067.
Thank you, Madam Chair. I feel like my chair is so low. AB 1067 amends the Code of Civil Procedure to resolve a split in authority as to whether an order denying a motion for reconsideration is separately appealable. By clarifying that an order on a motion for reconsideration is not an appealable order, but may be reviewed on appeal from a final judgment or from the underlying order that is appealable, this legislation would eliminate the possibility that a party would have 2 appeals from the same decision. It is sponsored by the Conference of California Bar Associations and supported by the Judicial Council, and I'd like to turn it over to those witnesses unless there are any questions for me.
Good afternoon, Madam Chair and members. Larry Doyle on behalf of the Conference of California Bar Associations. This is if not an eyes glaze over civil procedure bill, certainly a complicated one, but there's a split of authority. The conference believes that the majority that's emerging is going the right direction in the area of judicial economy and trying to reduce the number of appeals. And we ask for your support for the bill.
It's of interest to trial lawyers, trial lawyer wonks like myself. Go ahead.
Chair and members, Dan Pone from the Judicial Council, for all the reasons that are set forth in the excellent, very thorough and cogent analysis. As he mentioned, it's some tricky kind of case law, but she got it absolutely right, and for those reasons, we urge your aye vote.
All right, thank you very much. Any other witnesses in support? Any witnesses in opposition? Did you have a comment, Mr. Leno?
This non-attorney's eyes are glazed in support of the bill.
Thank you.
I move the bill.
All right. Okay, we have a motion. Would you like to close, Ms. Huber?
Just respectfully ask for your aye vote.
Great. This is of interest. I mean, I kind of like civil appellate law myself, and knowing that generally orders are not appealable in the middle of the case, this just makes sense. And I appreciate the opportunity and that you've brought forward to resolve a split of authority in the state of California. It's also very interesting. Okay, any other comments or questions? I'm sorry, I like this stuff.
I do too.
I know you do. All right, we have a motion. We'll call the roll.
The motion is due pass to the Senate floor. Evans?
Aye.
Evans, aye. Harmon? Blakesley? Corbett? Leno? Leno, aye.
All right, we have 2 votes, 2 aye votes. We have 3 absent members. We'll keep the roll open. Thank you very much. All right, next, Mr. Alejo, not here? Okay. Mr. Hill, you are up next. Item number 11, AB 1349. This is another interesting bill.
You get a lot of them, don't you?
Yeah, it was not a situation I was aware of. Go ahead, Mr.
And
Hill.
myself
Go ahead
either.
and present the bill.
But it seems to need a correction. Madam Chair and members, AB 1349 will help ensure that the best interests of a child are considered in paternity disputes. The bill simply allows the court to take into consideration the person who helped raise the child if a custody dispute arises involving the biological father. The bill stems from a 2009 California Court of Appeal decision where a woman conceived a child with a man but gave birth to the child and raised the child with another man. This non-biological father was seen by the child as his father because the man had raised it without the mother together and in the same house. It raised it with the mother together in the same household. After a couple of years together, the mother, maneuvering to exclude this man from the child's life, was able to find the biological father and have him sign a voluntary declaration of paternity. The Court of Appeal determined that the declaration of paternity overrode any other factors and denied the non-biological father's petition to be the legal father. This essentially removed the non-biological father from the child's life through no fault of his own. It didn't matter that the biological father had played no part in the child's life and that there was little evidence he would do so in the future. Even though this non-biological father had taken the child into his home, helped take care of him, sufficient to legally be considered a parent, the court could not give consideration to his request for legal paternity, a status which would have allowed him reasonable visitation rights. The voluntary declaration process was meant to facilitate the establishment of parentage in uncontested situations. It was never designed to address competing parentage claims. This bill gives courts the authority to consider setting aside a voluntary declaration of paternity if doing so would be in the best interest of the child. In the 2009 case, the court's hands were tied, and the best interest of the child was, by statute, not allowed to be considered. The bill prevents the perverse situation where California law, which respects a child's needs for two parents, can mandate that paternity be awarded to an absent father. With me today is Deborah Wald, a practicing lawyer, and Kim Smith, whose story can better illustrate the need for this legislation.
Go ahead.
As a practicing family law attorney, I'm grateful to have this opportunity to speak to you briefly about why this bill is so important. Voluntary declarations of paternity do serve a very important and valuable service. They provide a streamlined, no-cost way for unmarried couples to establish legal paternity of their children to everyone's benefit. But they were never intended, as the Assembly member said, to be used in contested parentage cases to resolve disputes among multiple potential parents. And when used that way, they serve to elevate biological paternity over all other factors in direct contradiction of California Supreme Court authority. AB 1349 is designed to correct that situation. Under current California law, biology is an important factor in determining a child's legal parents, but it's not the only factor. Courts must also consider marital and domestic partnership presumptions, as well as procreative intentions and parental conduct. In 2002, in In re Nicholas H., the California Supreme Court ruled that proof of biological non-paternity did not necessarily rebut the parentage presumption that comes about when a man receives a child into his home and holds that child out as his own child. In 2005, in Alyssa B. versus Superior Court, our Supreme Court expanded that holding to find that a woman who receives a child into her home and holds that child out as her own can be the second legal parent of that child, along with her lesbian partner. In 2009, in Kevin Q., essentially those cases got overruled and a loophole was created whereby a biological mother simply has to find the genetic father of her child and get him to sign a piece of paper, and she can zero out any claim to parentage of the other person who's raised her child with her. And we're simply trying to correct the miscarriage of justice we saw in the Kevin Q. case and allow the courts to, in fact, take into consideration the actual needs of the children before them and make sure those needs are protected. Thank you.
Okay, thank you. Other witnesses?
Hi, dear members of the Senate. My name is Kimberly Smith from Santa Cruz, California. I'm in favor of this bill because without its protections, non-biological parents like myself risk losing our children in parentage battles. My female ex-partner and I were together for 3 years, and we planned a family by utilizing a sperm bank in SF in 2008. After several unsuccessful attempts, we finally asked the boyfriend of a friend if he would be interested in helping. We paid him $540 with the mutual agreement that he would have no legal or financial obligations to our child, which was fine. We immediately became pregnant with twins. My work benefits paid for the pregnancy. I cut both of my sons' cords. I named our children, was listed on their birth certificates, where they took our hyphenated last names, and I took 3 months off from work to nurture and provide for them. I was also our children's primary caregiver in this first 6 months of life, where I slept with them and provided them around-the-clock care, including feedings every 3 hours. The donor had met our children only 3 times for no more than an hour total before moving to Hawaii. In September 2009, we broke up and ended our relationship, and I was immediately deprived of visitations. Days later, I filed a parentage suit in Santa Cruz, California, and the court immediately granted me visitations as an assumed parent to last the duration of my trial. In response to this ruling, my ex-partner contacted our donor in Hawaii and convinced him to move back to California to live with her and our babies in an attempt to trump me out of my legal rights. My ex and our paid donor staged an intimate public relationship and secretly filed their own voluntary declaration of paternity in family court right behind mine, listing themselves as the uncontested biological parents to our children. This was about the same time that my attorney, Deborah Wald, had some terrifying news. There was a case called Kevin Q out of Southern California that could have devastating implications to my case if my ex's attorney, our donor's attorney, and or the family court judge got wind of it. Up until this point, we were fairly confident in relying on our other path-breaking cases in California that had paved the way for non-bio moms like myself, but now we were faced with absolute uncertainty and total fear. It was at this juncture that the National Center for Lesbian Rights joined my legal team. 1 week before our case was to go to trial, my ex and the donor had a falling out, and I was fortunate enough to win my legal rights through last-minute mediation by our judge, where I was awarded 50-50 legal and physical custody. Had my ex and the donor stayed together and this case gone to trial, based on the outcome of Kevin Q and its holding political legal weight in my county's jurisdiction, I could have lost all legal rights to continue being a parent to our children. The children I intended and helped plan for, raised, loved, and nurtured. Please pass this important bill to protect all non-biological parents from potentially losing that right to continue to love, nurture, and parent the children that we plan for and promise never to give up on. Thank you.
Thank you. Thanks for sharing your story, painful as it is. Other witnesses?
Good afternoon, Madam Chair. Mario Guerrero with Equality California. We're a sponsor of the bill and respectfully ask for your aye vote. Thank you.
Thank you. Other witnesses in support of the bill?
Madam Chair, members, Donna Brownsey on behalf of the Academy of California Adoption Lawyers. We are one of the co-sponsors of this bill.
Great. Any opposition to the bill? Seeing no opposition witnesses, we'll bring it back. Ordinarily, I would ask you to respond. Any questions or comments from committee members? Mr. Leno?
I think the telling point here is, as the Assemblyman pointed out, that the original intent was for these non-contested situations, and we know how this impacts families where the situation otherwise. So I'm glad to support the bill, and I move it.
Thank you.
Yeah, I just wanted to make a couple of comments. This was a very interesting bill when I first looked at it, and I actually had to get my way to supporting it because it's not that easy to understand the ramifications of this. And I'm old enough to have gone to law school when there was a non-rebuttable presumption that someone was a father if they were married to the mother during the time of conception and birth, and that's kind of as far as I had gone in that understanding of the law. But we've come a long way since then, and relationships have changed, and the law has to keep up with it. And the best interests of the child should always, always be the most important thing. And that's what your bill does. Make sure that it's the best interests of the child. And we want to avoid situations like you've had to endure. And I appreciate your coming and telling us what has happened, and we want to avoid that. And I think that this bill goes a long way towards doing that. So I'm very happy to support it.
Thank you.
And I believe we have a motion. So would you like to close?
No, I just respectfully ask for an aye vote, and thank you for the comments and the questions. Appreciate it.
All right, we have a motion. We will call the roll.
The motion is due pass to the Senate floor. Evans?
Aye.
Evans, aye. Harmon? Harmon, no. Blakesley? Corbett? Leno? Leno, aye.
All right, the vote is 2-1 at this point, so we do have 2 absent members. We'll keep the roll open. Thanks very much.
Thank you, Madam Chair. Thank you, members.
All right, Mr. Alejo, you have the last bill on our agenda today. It's item number item number 10, AB 1155. Go right ahead.
All right. Thank you, Madam Chair and members. Today I bring you AB 1155, which bans discrimination based on immutable characteristics in workers' compensation disabilities claims. This bill does not eliminate apportionment if a pre-existing disability exists. This bill simply clarifies that if there is no disability at the time of injury, there should be no apportionment based upon race, gender, religious creed, color, national origin, age, marital status, sex, sexual orientation, or genetic characteristics in workers' compensation disability claims. There is not one single other example of a state program that allows for discrimination against these protected classes. This bill takes the exact language used in at least 13 other California code sections and applies those protections to workers' compensation disability claims. Let me give you a real-world example of the problem that this bill will address. In San Diego, a Costco worker with no history of hypertension was injured after exposure to cleaning chemicals. The physician determined he had a work injury with permanent disabilities due to hypertension and chronic asthma. Yet this worker lost half of his permanent disability compensation because he was African American and he has a genetic predisposition to hypertension. Is the fact that this worker is African American a quote-unquote cause of those problems? Should his injury be apportioned and his disability payment reduced due to the fact that he is African American? I don't think it should. That clearly to me is discrimination, and that is the purpose of this civil rights bill. I ask for your aye vote. And here with me to testify is Marguerite, who will address your questions as well.
Very good. Thank you very much. Go right ahead.
Thank you, Madam Chair. I'm Marguerite Sweeney, and I have been practicing workers' compensation law, representing injured workers and their families for over 32 years, and I'm very proud of that. And the legislature has long intended, and it again showed that again in 2004, that employers should not pay for permanent disabilities that are caused by factors unrelated to the job. We agree that employers should not pay for disabilities that are unrelated to a job injury. However, what's happening today with the Labor Code 4663 and why we seek to amend it is that that law, which apportions to causation, is being applied by doctors, lawyers, and judges to reduce an injured worker's permanent disability on account of immutable characteristics such as gender, race, age, even ethnic background. And I believe you would have examples of that in your materials. We're seeing this in real life, on the ground, examples. There's a lack of clarity, and we think that this legislation, this bill, would clarify and end discrimination that is clearly prohibited in other areas of law. We know the legislators did not intend or expect this type of application to occur. And the reason it occurs is because doctors are asked to apportion between a job injury and other factors. And in the world of medicine, sometimes the fact of gender or race is a risk factor in the development of a certain kind of medical condition. So once that condition or injury has manifested itself, then an evaluating doctor for medical, legal, forensic purposes will look at the condition, look at the permanent disability, and if they see risk factors, then they may, in hindsight, look back and say, oh, being female is one of the causes of this permanent disability. That's the problem. That's why it's occurring. And so it's a de facto discrimination, not an intended discrimination. And Assemblyman Alejo's bill, and I believe Senator Leno's bill also, would solve this problem. Thank you.
Very good. Thank you. Any other witnesses in support of the bill? Go ahead and take these seats. Go ahead.
Thank you, Madam Chair, members of the committee. Mitch Seaman with the California Labor Federation. We're here today in support of this bill mainly just because we believe that it extends fundamental civil rights to injured workers, and we urge your support.
Linton Borden with the California Conference NAACP in support.
Other witnesses in support, come on up. Don't be shy.
Thank you. Scott Bernstein here on behalf of the California Employment Lawyers Association. We're in support.
Madam Chair, members of the committee, Lee Sandall with the International Longshore and Warehouse Union, and we are in support.
Thank you. Any other witnesses in support? Witnesses in opposition, come on up. There's 2 seats up here.
Good afternoon, Senator. Cynthia Leone with the California Manufacturers and Technology Association. We're here to oppose the bill unless it's amended to clarify existing law. I think we all agree, and I appreciate the proponents' comments that we believe that the apportionment statute that's in the work comp labor code, in fact, does not, the intent was not to apportion to race or other protected classes. One of the things that apportionment did was to clarify exactly how apportionment was to be conducted. It was one of the things that we got out of the reforms. Apportionment is an issue of fairness for the employer. So the employer is only liable for the injury at hand, at the industrial injury at work. Therefore, the doctor must consider any other factors that might be contributing to the overall disability that has been determined. There is significant case law that has outlined that apportionment has been practiced legally, that there have been cases where if the doctor does not provide sufficient medical evidence to determine that the apportionment is done based on the medical condition, that it's remanded and fixed. So based on case law, we haven't seen exactly where the problem is. Nonetheless, we believe that we do need to clarify, so we have proposed amendments. The amendments actually simply strike 3 words from the proposed language that the authors have put forward. It strikes out cause or other, therefore making it very clear that no protected classes, race, religion, and so forth, will be considered a factor of disability. By striking those 3 words, it makes it very clear and consistent with the rest of the statute that we do not want to apportion to these protected classes. And I think this is a really good compromise. I mean, if we move forward with the language as is, we're going to create a lot of confusion with regards to any disability that might be associated to a protected class. So this is extremely important. I think we have offered these amendments as a forum to clarify existing law, because we do believe that we can do that. But if the intent is to change the application of apportionment, then that's a whole different conversation. We are changing the statute to a manner that would actually increase litigation and increase cost in the work comp system, which we could not afford at this time. We want to make sure that we protect the injured worker, make sure that they have a fair apportionment, and therefore we believe that these amendments are very fair and in fact reach the goal that I think we both claim is the intent, to simply clarify what's current practice and ensure that the application of apportionment stays intact, because this is a matter of fairness for the employer.
Thank you.
Thank you, Madam Chair and members. Jason Schmelzer with the California Coalition on Workers' Compensation. We certainly agree in principle that doctors and attorneys shouldn't be creating apportionment out of whole cloth just because someone's a member of a protected class. But we are concerned about real apportionment, real disability that did exist prior to the injury. I have a member, Michael Sullivan, with the law offices, Michael Sullivan, that I think can shed a little bit of light on the current language and why it's a problem in legal terms. So with that, I'm going to go ahead and hand it off to him.
Sure. And I do want to say, I struggle with this, and I think it's going to come up during the discussion from the opposition because, number one, causation is still a factor, and I'm not a workers' comp lawyer, but I know that it's still a factor in considering apportionment. So that's one struggle that I have. And the second thing is, with respect to cost, if in fact doctors are already doing this, if they're already taking these things into consideration when they're making the apportionment, isn't it already costing more to go through this process than it would if the legislature just said at the outset, you cannot determine that race or gender or any other protected class is a cause of a disability. I mean, it seems to me there would be less litigation, less costs associated with the law if it were written much more clearly so that physicians would not do this. But go ahead.
Well, I think a lot of people share your confusion about workers' compensation. I didn't understand anything about it.
I didn't say I was confused. Okay. I was married for almost 30 years to a workers' comp defense lawyer, but I've never done it myself.
I'm sorry.
Go ahead.
I'm still confused, and I've been doing this for 20-plus years. I run a medium-sized, I'm the principal of a medium-sized workers' comp firm in Southern California with 4 offices, and, I oversee about 1,000 cases at this particular time. I've also written what I hope is a definitive treatise.
Could you start with your name? I'm sorry.
Sorry, Mike Sullivan.
Go ahead.
I'm here to testify that I don't believe the culture of discrimination that has been described here, with due respect, exists. You've heard anecdotes, one story, and you've heard allegations that doctors are saying this. But I can tell you that I don't think that makes a case. And in my experience, this isn't happening. And the reason it isn't happening, and I'll support it with more than an anecdote, is because the statutes forbid it, and the case law, the reported case law, doesn't contain it anywhere, ever. Okay? I've read every single apportionment case since 2004. You know how many of those cases describe a situation with the kind of discrimination we're talking about here? None. There's only 2 reported cases which speak to this issue. And in both cases, they both came down heavily saying, look, this kind of discrimination is against the law and it's not going to happen. I think there can be a fundamental misunderstanding about workers' compensation. You can talk about someone, let's say, with a racial predisposition for a disease. That goes to the cause of injury, and this has been explained in the cases I described, United Airlines versus WCAB and Viera versus WCAB, a writ-denied case and an admittedly unpublished appellate-level decision. And in both of those cases, they said, yes, these things are risk factors for injury, but you can't apply them to permanent disability. And that is the law as it stands. And there's no reported case that supports what's being said here. And the statutory law forbids it, specifically Government Code 1135A. Which prohibits in any organization administered by the state any of this kind of discrimination. Now, look, what you said earlier is, well, what's the problem? Why don't we reinforce anti-discrimination law? Why do you have a problem with that? And the answer is, I don't. But what I do have a problem with is the way this statute is constructed. The language prohibiting disability is a cause or other factor of disability. The lobbyists have talked to the other side about just eliminating cause or other, leaving factor of disability. I'll ask you to bear with me here for just a minute because it's a little esoteric, but it's really important.
We are going to need you to wrap up in a couple minutes, so we still have a number of witnesses to go through.
Okay, well, then I will. What this language does, and all you have to do is eliminate 3 words, and you'll still have the protection, and we'll support it. But what the language does is break down a barrier between factors of disability and cause and disability. If you break down the cause and the factors, any condition which is an alternate form of disability can be considered, and is linked to a protected class, can be considered suspect. There's one thing, and I'll leave you with this, because I know you want me to stop talking.
Smart lawyer.
Thank you. I'll take that whenever I can get it. I'll just leave you with this, is I know one thing is going to happen if you don't take out those 3 words. It won't make any difference in disability because you'll protect it with the other words that are in the statute. But what will happen is every case where an argument can be made that there is a link between a protected class and an alternate non-industrial disability, that will be questioned. And in a large, significant portion of cases with apportionment, we will be litigating them. And they will, I've seen it many, many times with every time a bill is passed, we're going to have a large fight over a lot of cases, and we're going to grind slower and slower. And so I'm just asking you, please, look at our proposed modification to the 3 words out. You'll still have the disability protection, but you won't put us in that position and cost us so much money.
Thank you. appreciate your thoughts. Yes.
Madam Chair and members, Theo Pejos, representing the Association of California Insurance Companies. Just a couple of quick points. Number one, the apportionment is actually pretty simple. If you have a documented manifestation of a disease or an injury prior to the at-workplace injury, then you can apportion to it. If you don't, you can't. We can't control what doctors say. While most doctors are very professional and very good at what they do, there are some crazy doctors. Every time they've written down something that this bill would purportedly stop, it has been rejected by the appeals board. So there really isn't a problem here. What there is a problem with, though, is that some of the cost drivers that were making signals in 1999 and 2000 before the collapse of the market are on the rise again. One of the problems with a bill like this is it increases frictional costs. As the attorney said, more of these cases will be litigated. As you leave these cases open and they're not closed, permanent disability costs go up, medical delivery costs go up. It's all one. We don't separate necessarily the indemnity from the medical. And when you open that up, God knows how much of a increase in cost that the system will have to absorb. And for those reasons, we're opposed.
Thank you very much. We've now had quite a lot of opposition testimony. I'd ask you to limit your statement to your name and affiliation, please.
Sure thing. Thomas Vu with the California Chamber of Commerce in opposition.
Thank you. And the witnesses can move on up.
Amber Wiley with the Alpha Fund, also in opposition for the reasons previously stated.
Steve Calmer on behalf of the Board of Supervisors of Los Angeles County. We appreciate what the author is doing. We just think the language needs a little bit of tweaking.
Thank you. Any other witnesses in opposition? Okay, let's bring it back then and ask you if you'd like to respond to some of the issues that were raised. I did want to mention the proposed amendment. We have looked at that, and I believe it was also raised in Assembly Judiciary, if I'm not mistaken. I actually, in looking at the language, I think that proposed amendment makes it less clear, and I know reasonable lawyers can disagree, but it doesn't seem to clarify it to me. I think we'd have a lot more litigation. Go ahead if you would like to respond.
Thank you. Yes, I agree with you, Madam Chair. It would make it less clear, and the reason is going back to the Legislative Digest and forward and looking at the statute itself, the word cause and causation is used repeatedly. So I do think that it adds clarity. It's important to leave it in. And very briefly, with all respect to Mr. Sullivan, I have personally seen many examples of this kind of discrimination de facto because, and by some very highly respected agreed medical examiners, one comes to mind in San Francisco, who have testified under deposition that they believe that this is what the legislature has told them to do. I also think that costs are going to be reduced with this bill, not increased, because now in order to get the kind of clarification, it requires more litigation or we settle the cases, and in those cases, there is a takeaway for the injured worker based on an opinion that is apportioning part of the disability to an immutable characteristic. Finally, I think that it's very important to, when you talk about workers' comp costs, to talk about what really are the costs. And it's not this, it's not indemnity, and it's not litigation over proper apportionment understanding. It's medical treatment costs. So you can't lump them all together. Thank you.
All right. Any other questions or comments from the committee? You may close.
As for your aye vote.
All right. I believe it's time to entertain a motion. All right. We have a motion from Mr. Leno. We'll call the roll.
The motion is due pass to Senate rules. Evans?
Aye.
Evans, aye. Harmon?
No.
Harmon, no. Blakesley?
No.
Blakesley, no. Corbett? Corbett, aye. Leno? Aye. Leno, aye.
All right, the vote is 3-2 on that. Again, another very interesting bill that raises a lot of issues that are worthy of discussion. I appreciate the debate that we just had here. And your bill is out.
Thank you so much,
Thank
Madam
you.
Chair.
Okay, I believe we have everybody here, so we're going to go back through the list of bills, and I believe, Mr. Leno, you voted on all of them. We'll start with item number 1, AB 126, Davis. Call the roll. The vote is, the current vote is 2-1.
Blakesley? Blakesley, aye. Corbett? Aye. Corbett, aye.
The vote is 4-1. That bill is out. Item number 2, AB 173, Mr. Gatto.
Blakesley? Blakesley, aye. Corbett? Corbett, aye.
And that is 5-0. That bill is out. Item number 3, AB 499, Atkins. The vote is 2-1 currently. 2-0.
Harmon? No. Harmon, no. Blakesley? Corbett? Corbett, aye.
So the vote is 3-1. That bill is out. All right. All right, let's go back to item number 3.
She just announced the vote.
We just announced the vote, so we need to reconsider? We do.
You need a motion to reconsider. You need a motion to reconsider for a favorable vote to re-vote on the whole entire bill.
But we've got an exit number.
Oh, yeah, we do.
Mr. Leno just left. So either you're off or he's off. I can't do that.
Oh, what you need is to get the roll and re-vote.
Yeah.
We have to re-vote the whole thing.
Yeah, I'm sorry. I was looking at one measure and I couldn't understand the vote time.
Yeah,
And it didn't make sense, and then I realized that you were talking about your next bill on the list.
That was item number 3.
499.
Yeah. So I was looking at 3 and trying to understand.
All right, let's see if we can get Mr. Leno back.
Well, I'm sorry.
No, I think we're happy to help you. We have got to make sure it doesn't change the outcome of the vote.
Yeah. So if we can get him back, then we can make a motion and we'll.
Great, thanks.
Okay. Let's go to item number 4, AB 559, Swanson. Currently, the vote is 2-1.
Harmon? No. Harmon, no. Corbett?
Aye.
Corbett, aye.
That vote is 3-2. That bill is out. Item 5, AB 588, V. Manuel Perez. Currently, the vote is 3-0.
Harmon? Aye. Harmon, aye. Corbett?
Aye.
Corbett, aye.
That vote is 5-0. That bill is out. Item number 6, AB 887, Atkins. Currently, the vote is 2-0.
Harmon? No. Harmon, no. Blakesley?
No.
Blakesley, no. Corbett?
Aye.
Corbett, aye.
That vote is 3-2. That bill is out. Item number 7, AB 929, Wykowski. The current vote is 2-0.
Harmon? No. Harmon, no. Blakesley?
No.
Blakesley, no. Corbett?
Aye.
Corbett, aye.
The vote is 3-0. That bill is out. 3-2. Thank you. That vote is out. That bill is out. Item number 8, number 997, Wagner. Currently, the vote is 3-0.
Blakesley? Aye. Blakesley, aye. Corbett?
Aye.
Corbett, aye.
That vote is 5-0. That bill is out. Item number 9, AB 1067, Huber. Currently, the vote is 2-0.
Harmon? Aye. Harmon, aye. Blakesley? Aye. Blakesley, aye. Corbett?
Aye.
Corbett, aye.
The vote is 5-0. That bill is out. Item number 11, AB 1349, Hill. Currently, the vote is 2-1.
Blakesley? Corbett?
Aye.
Corbett, aye.
That bill is 3-1. That bill is out.
I know the numbering on each of these bills is different on my sheet than yours. Our analysis evidently had those off by 1, so we said item number 5, and then you said the bill. I got the same 5 was a different bill, so I was proof last. So anyway, problem none of you. Just so you knew. Look, I don't want to hold people up. I can be not voting on this and then repair it on the floor if I need to be.
Okay, all right. We are done. The business of the Judiciary Committee is completed, and we will adjourn.